In this video, we will discuss about why NK-92 cells are preferred for off-the-shelf cancer therapy. So, one of the advantage of this off-the-shelf cancer therapy is that one don't need to design these NK-92 cells from the patient's NK cells. So, these NK-92 cell lines are commercially available, and these NK-92 cell lines can be modified way before against the most commonly expressed tumor antigens. So if those antigens are present in the patients, then this NK-92 CAR or modified NK-92 cells can directly be used against the patients or in the patients against the tumors. So why these NK-92 cells are preferred over these primary NK cells? So one of the differences is these primary NK cells. If primary NK cells preparations will take time, and sometimes patients conditions might be critical, so they might not have enough time for this uh, primary NK cells to be modified. First they need to take out the primary NK cells from the patients, then do the modifications, and again then induce those modified primary NK cells into the patient. And even then there is a possibility that efficacies of these primary NK cells are low compared to the NK-92. And one of the reasons is that primary NK cells also has this inhibitory receptors. So once this activating receptors interact with the lesion, there is a possibility that these inhibitory receptors might also interact with this HLA ligand or HLA ligand which are present in the tumor cells. This basically act as a immunosuppressions interactions. So it will suppress the activations of these primary NK cells, and thereby the efficacies of these primary NK cells against the tumors goes down. However, what has been found in the NK-92 cells is that they are devoid of, or they have almost devoid of most of this inhibitory ligand. So even though these receptors are present in this HLA receptors are present in the target cells or the tumor cells, they cannot be interact with these counter receptors on the NK-92 cells, and thus the activating of these NK-92 cells will be more consistent, and its efficacies against the tumor cells will be more, since the activating of the NK-92 cells are more consistent. And once this interaction occurs, what it will does is it will release the lytic granules at the site of interactions, and those lytic granule release could be the granzyme or perforin, so that will trigger the apoptosis in the tumor target cells. So here in the primary NK cells, what happens is cytolysis inhibited through this HLA ligand and inhibitory receptors interactions. However, in the case of NK-92 cells, there is an induction of cytolysis, and the inhibitions of the cytolysis is very minimum or almost negligible, because these NK-92 cell lines are devoid of these inhibitory receptors. This is one of the advantages. And another advantage that I have mentioned at the beginning of this video is availability all the time, or in common terms it is called it off-the-shelf cancer therapy. That is, the modified NK-92 cells are available already in the lab or already in the hospitals in a controlled conditions, that can be used against the patient in the short period of time. So this is why people normally prefer NK-92 cells over this primary NK cells. And one problem that might occurs, or one of the advantage of this primary NK cells from the patient, is that the possibility of immunogenicity is very low, and people have seen these NK-92 cells also shows like not that much immunogenicity or tolerable immunogenicities. So this might have some advantage, but one things also need to be taken care of or observed during its treatment is the immunogenicity level. or whether they reach the threshold or not. And these things depend on varies from patient to patient. However, in general, NK-92 is considered as a tolerable cells target cancer therapies to target cancers, and it is commercially used cell lines for this off-the-shelf cancer therapy. So that's all for this video. If you need to understand more about these experiments in detail, you can go through the reference that has been provided in the description. And the point that I mentioned about the commercially used cell lines, I'm not sure about it, but in the literature it is well known that it can be used for the cancer treatment in the patient. Thank you for your time.